Mark. We're joined tonight by Dr. Matthew Winkleman of SIH Primary Care in Harrisburg. Dr. Winkleman, I want to thank you for being here with us and taking time out of your day for this. Now, the big news of today, of course, Illinois Governor J.B. Pritzker announced an indoor mask mandate. It starts this Monday. I guess to kind of get us started here, what are your thoughts on that?
Yeah, I mean, I think it's a good measure. Definitely we have seen in good studies that consistent wearing of masks, wearing them appropriately, particularly when indoor, when it's difficult to distance, reduces the spread of COVID-19. And so it's not perfect. I think sometimes I hear people talk about masks and they say, well, they don't work because they don't work 100%.
Yeah.
But they definitely reduce the risk. And primarily we're talking about reducing the risk of me spreading it to you when I'm maybe infected and don't realize it yet.
I see. And do you think a mask mandate is an appropriate measure? Do you think it'll help curb the surge that we've been seeing?
I think it's one piece in a number of tools that we have to try to reduce the spread and take some of the burden off of our healthcare system that's really being stretched to the very limits right now.
And may I ask, being a healthcare worker yourself, what are you seeing kind of on a day-to-day basis now?
Well, I mean, we're just seeing lots of cases, lots of people presenting with symptoms. As you're probably aware, hospitals throughout the region are bursting at the seams. Our intensive care units are completely full. Today, the highest number of COVID patients in SIH hospitals since the beginning of the pandemic.
Wow.
So we're just seeing continued cases in our community, ICUs full of COVID patients, limiting our ability to take care and treat other patients.
That's a great point too, because when someone with COVID-19 is taking, an ICU bed or spot, so to speak,
Right.
What can you do for other patients even?
Right. Yeah. So it's not uncommon right now for patients that need to be admitted to the hospital to be kept in the emergency room for hours and hours waiting for a bed to open up. And one of the things that we see is that often the patients hospitalized with COVID-19 are having very extended hospitalizations. They're not there for 2 or 3 days. They're there for 1 to 2 weeks sometimes. Wow. And so it's a while before that bed then opens up for another patient to fill it. The patients are very sick, they're requiring a lot of care, and then those beds are full, and it's making it hard to do other things, let alone the routine things, more elective things, joint replacements, and some of those things that are needed to be done. It's just really stressing the overall healthcare system in our community.
Yeah, I bet. And, kind of coming back here to Governor Pritzker's, announcement today, he also announced a vaccine mandate. I want to make sure I get this correct, for P through 12 teachers and staff, higher ed staff and students, and healthcare workers. Now, do you think that's an appropriate measure to take?
I think these are extraordinary times that we're dealing with, and we have to be aggressive in trying to do what we can to alleviate the burden on our healthcare system. That's at the crippling point. We have always used vaccine as a primary tool in the prevention of disease in the community. We require vaccines for all kinds of diseases, for children, for healthcare workers, and those diseases aren't having anywhere near the kind of burden that COVID-19 is having right now. And so to encourage people and require people to take this step, I think it's a reasonable measure to do. We know that kids do better when they're in school, learning in person. So many of our kids suffered a lot last year because of the not only the inability to be in person and learn, but so many kids depend on the school system for very critical social services as well. And so the more things we can do to keep kids in school and learning in person, I think the better. And I think, as we mentioned, vaccine is one of those tools, along with consistent use of masking, using them appropriately, social distancing when possible, that will help us kind of flatten this curve and get to the other side of it.
And, touching on vaccines, Pfizer's vaccine does have full FDA approval. Can you kind of elaborate on what that means as opposed to emergency use authorization?
Yeah, I think the real difference there is just a little bit longer time of data review. So the initial emergency use authorization had a look-back period of about 2 months. They requested an additional 6 months of data for the full FDA approval. And so there was just enough time to look back. We have a very good safety profile with these vaccines, upwards of 350 million doses given in the United States, and very low rates of side effects. I think sometimes people get concerned about what felt like a very sped up process. And I think part of the reason for that is that we were able to do things simultaneously that maybe in previous times had been done in sequence. So maybe in a normal scenario, you would do step 1 and then step 2 and then step 3, waiting to make sure step 1 worked out okay before investing the resources in step 2. Because if step 1 doesn't work, then why put the money and resources into testing step 2? But in this unique kind of once in a lifetime pandemic, the resources poured into the effort by the government allowed them to do step 1 and step 2 at the same time, sort of taking the gamble that if step 1 doesn't work out, we've wasted the resources we invested in step 2. But fortunately, everything worked like we hoped it would, and we were able to get the vaccine produced quickly and get it to people that really needed it. And hopefully that helps reassure people about what felt like kind of a sped up process. I think it's a mistake to think that things were skipped. I think all the normal processes were conducted just sometimes at a simultaneous rather than in sequence.
And do you think that's kind of where this notion of maybe an experimental drug or experimental vaccine kind of comes in for folks?
Sure. I mean, everything when we first use it, it would be considered experimental. I mean, there are normal processes of testing to ensure safety. But the technology for particularly the Pfizer and the Moderna mRNA vaccines has not been new. It's been around for decades, was studied pretty extensively with some of the previous coronavirus pandemics like SARS and MERS. But because those pandemics kind of fizzled out on their own, the funding and the effort really didn't get continued. And so we were able to take that background off the shelf, so to speak, and really start with a head start in developing vaccine against COVID-19.
Wow, I had no idea, personally. And may I ask, when you see a patient come in with COVID-19, are there different symptoms for the Delta variant as opposed to maybe the original strain?
I wouldn't say there's any specific symptoms that I would say distinguish Delta variant from other previous strains we've seen. I think that's one of the things that's been so challenging about this entire pandemic is that people with COVID-19 have such a broad spectrum of symptoms. I don't feel like there's any one symptom that I can point to and say, well, if you don't have that, you don't have COVID-19. I'll hear people sometimes say, well, I don't have a fever, so I couldn't have it. Or I still have my taste and smell, so I couldn't have it. But I see people all the time who tell me, well, I thought it was a cold, or I thought it was my allergies, or I thought I was just tired, and turns out they're positive. And so it makes it really tough for us to diagnose it outside of a test. And I think people sometimes get frustrated because, they approach their healthcare provider with what they think is a cold because it feels similar to what they've had in the past with colds. And we're trying to be cautious about identifying those cases that are COVID-19, partly so that we can prevent it from spreading elsewhere in the community, identify those cases and appropriately isolate people when they have it.
Yeah. And when it comes to treatment, we're talking about monoclonal antibody therapy. I guess if I may what is that? And then we even had a viewer question, who qualifies for that therapy?
Yeah. So it's one of the few things that we have research suggesting is beneficial for treatment, particularly in the outpatient setting. So we're talking about patients that aren't needing to be in the hospital. So monoclonal antibody is basically an infusion through an IV of proteins that are directed and infection-fighting proteins. So basically these proteins are similar to the proteins your body would naturally make in response to an infection. But when you contract COVID for the first time, your body doesn't have the ability to generate those antibodies that rapidly. And so the infusion gives you those antibodies directed against the virus, which attach to the virus and prevent the virus from attaching to your cells and infecting you. It is approved for use in patients that are not requiring hospitalization and not requiring supplemental oxygen. So we're talking about patients that are not sick enough to be in the hospital, not needing extra oxygen, and that are at somewhat higher risk of complications. So there's a smaller group, people that are over 65, people that have other health conditions like high blood pressure, diabetes, people that have underlying lung disease, people that are overweight with a body mass index greater than 25. So it's a big group of the population that qualifies, but it's not everybody. And so I think it's important to recognize that while it's a helpful tool to treat people that are already infected, there's a big group of people, particularly people under 12, people under 65 who are otherwise healthy that don't qualify. And so I don't think it's a replacement for our efforts to work with the vaccine, but it's another tool we have to try to keep people out of the hospital.
I see. Thank you for the clarification on that. And, you know, I think I speak for a lot of folks, you know, we're kind of antsy to get back out into the world.
Sure.
You know, the DuQuoin State Fair is coming up. A lot of, you know, summer activities are coming up. What, you know, are you nervous about that? What would you say to folks who are wanting to be, you know, out and enjoying themselves again?
Yeah, I guess my message would be, number one, recognize that this is a very real, serious pandemic in our community, that it's having an enormous impact on our ability to care for patients in the hospital. The hospitals are full of patients, making it hard to care for other emergencies, other like immediate healthcare problems. So we have a serious problem in our community. We know that this virus spreads through contact between people. We know that it's possible to spread that virus when you haven't developed symptoms yet. And so the ways that we can try to combat it are, number one, get vaccinated. No question. It definitely reduces the risk of hospitalization and death. Number two, wear a mask when you're indoors, especially if you're in close proximity to people. If you can't be distanced, wear a mask to help prevent that spread. And number three, be outdoors as much as possible if you have to be around other people. And definitely, if you're having symptoms, stay home. Don't go around other people. Get tested. There's all kinds of opportunities to get tested. Don't just assume that what you think is your cold is just a cold, because it may turn into something else. So that would be my message. Use some common sense. Take care of each other. Think about the people around you. I know it's hard, and we've been doing this for a long time, and all of us are extremely exhausted. The emotional toll on our healthcare workers, on the staff at my office, my colleagues, it's been exhausting. And I know it's the same for the people in our community. And there's this desire to get back to normal. And unfortunately, we're kind of at a point where we've got to continue to be mindful of the impact that has on the people around us.
Dr. Winkleman, I want to thank you so much for being here and for being so open with us.